I'm just gonna lift this up and take a listen, okay?
Uncertainty. It's a state Dr. Monica Vohra says many of her low-income, mainly immigrant patients are in when they arrive at Bread for the City's free medical clinic in Washington, D.C. But now, with a new occupant in the White House, the internal medicine physician says that state has been heightened.
Yeah, thank you. I think the language that's out there has been disturbing. Some of it has re-traumatized some of our folks who have been traumatized by previous policies, and so I think there's a sense of feeling unsafe and insecure.
She says that's because many of her patients who have received health care coverage under the Affordable Care Act are not sure if they will still have those benefits under a new administration. Lifelong Washington resident Brian Nabinet is at the nonprofit on this day, getting free groceries at the food pantry.
Oh, that's very important. We definitely need that. If we lose that, it's going to be another big problem.
Volunteer Patrice Ali, who has benefited from Bread for the City's food and clothing program while unemployed, says she worries about the growing income gap as well as the growing disconnect between politicians and the American public.
Since I've been in my 20s, I've noticed that the gap has increasingly gotten larger, no matter who is actually in that position of power or authority to run this particular country.
Concerns about the future and making ends meet are not confined to metropolitan areas of the United States. About a 2-hour drive from Washington, D.C., in York County, Pennsylvania, 1 in 9 residents do not have an adequate source of food. Last year, the nonprofit York County Food Bank distributed more than 900,000 kilograms of food to local churches and agencies that work with the neediest families in southern Pennsylvania. Debbie Kraut-Althoff is Director of Development at the food bank.
I think it's an eye-opening experience when you come back from lunch and you see people outside of our building lined up for blocks, to receive the food in all kinds of weather. And, you're just not, we kind of go through life with blinders.
York, New Salem resident Grace Geltrude says at one point she had 13 people living in her farmhouse. The grandmother says she relies on the food bank, welfare assistance, and a local health insurance program to fill in the gaps when her paycheck and husband's Social Security fall short.
I could not afford, the insurance any other way, with the bills and all. Taking care of a vehicle, it does get costly. And like I said, without some of these programs, people are struggling.
It's this struggle that Geltrude, Nabinet, and other Americans hope politicians will not forget as they debate changes to federal programs. Aru Pande, VOA News, Washington.